Hi, my name is Candice Roseberry, and today I want to talk to you about the ins and outs of EMS, or Emergency Medical Services. It usually starts something like this. It's 2 a.m. and you're awakened by a loud alarm, but that's okay because you work on the ambulance and this is normal. This is the beginning of your run, and it will go until you safely get the patient to the emergency room and turn the care over to the doctor or the nurse. Today, EMS consists of an array of people: EMT basics, paramedics, firefighters, and police. They are considered the backbone of emergency care. Now let's talk about the history and how it all got started. Emergency treatment goes back as far as the 18th century and has been linked to the battlefields of the world wars. They began this to emphasize the importance of rapid extrication and stabilization for patients located in the battlefields. In 1797, a French physician named Dominique Jean Leray developed the flying ambulance. This was actually a horse-drawn carriage that took doctors and supplies to those who were wounded on the battlefield. This is all according to the Rhode Island Medical Journal 2013 in the article An Overview of Pre-Hospital Emergency Services. EMS is a vastly growing field, and pre-hospital care has been found to be very important for patient outcomes. There are many types of services. EMS and fire work together and are interchangeable. BLS, or basic life support, is limited to the services that they can provide. ALS, or advanced life support, provides more care, such as airway management and medications. HEMS, or helicopter transport, is becoming more popular because it offers faster transport to ERs for quicker treatment. Some even have a doctor on board that can offer more advanced care to the patient. There is an order as to how we get the calls. A dispatcher gets the initial 911 call, and their job is very important because they are the ones who call for the appropriate units to respond. A first responder is usually first on scene, and they can be anybody from a volunteer or someone from the ambulance, fire, or police departments. It is decided then if the patient needs to have basic care or more advanced care, and each service is overseen by a physician that is known as their medical director. They are responsible for making protocols or rules that have to be followed by the EMS personnel. Paramedics can also call the ER and talk to the doctor that's on duty for further instructions if needed. We are known as the eyes and ears of the physician, so that you need to be able to tell the physician what's going on with the patient. Okay, so now that we know a little more about how the system works, let's look at the kinds of training you need to be able to work on the ambulance. There are specific curricula that have been developed by the Department of Transportation National Highway Traffic Safety Administration, and all testing is done by the National Registry of Emergency Medical Technicians. First responders have very minimal training but are usually certified in first aid and CPR. An EMT basic has at least 100 hours of training and classroom instruction. They have to be first aid and CPR certified, and they have to pass the National Registry. They can perform CPR and basic life support skills like providing oxygen and bleeding control. Paramedics, however, require much more extensive training. They have to be fluent in anatomy, physiology, and pharmacology. They have to be certified in CPR, ACLS, and PALS, along with other more in-depth certifications. And they too must pass the National Registry and be state certified. They can perform all basic skills, including more advanced skills like intubations, IVs, giving medications, and defibrillating a patient if needed. This is all found in the Emergency Medical Technician Education and Training article in the Rhode Island Medical Journal 2013. Okay, as you can see, it takes a lot of training to be able to do your job effectively, so let's look at some of the types of runs that you may run into. A lot of the runs will come out as being cardiac or heart related, whether minor or major. All of these calls require ALS skills. Minor chest pain could be something called angina, which can be treated with rest or a medication called nitroglycerin. Major chest pain can be a myocardial infarction, which is known to most people as a heart attack. This requires rapid transportation, and the patient will more than likely require surgery. The most devastating would have to be the cardiac arrest. This is when the patient doesn't have a pulse anymore and isn't breathing on their own. This is treated with CPR and medications. Then there are some calls that come out as chest pain that aren't heart related at all. They could be muscular or even lung related. Overdoses seem to be a very common problem in today's society. Usually the patient isn't breathing when you get there. Most of them can be given Narcan to bring them back, but it depends on what kind of medications they took or drug they took. Others have to be taken to the ER for further advanced treatment. Trauma patients are something you will also see. It's said that trauma is the leading cause of death in patients in the first 4 decades of their life. Airway issues are usually your biggest problem, and bleeding control is another very important aspect. They're actually bringing back the tourniquet that was very controversial for many years. Although you don't get pediatric patients very often, it's imperative that you know how to treat them properly. They're significantly smaller, and medication dosages are harder to calculate because of this. Trauma in pediatric patients is hard to determine because they compensate very well, but they also go downhill quickly because when they are done, they have no more gumph to fight anymore. So you always want to be more than prepared when you are dealing with kids, well, any situation really. Today we have discussed what EMS is all about. We have gone over the different kinds of services and the kinds of training that it takes to be able to work on the ambulance, and some of the types of runs that you may see. Every day is a surprise, and you really never know what you could get. EMS is a vital part of our community and the patients that we meet as well. If it weren't for the advancements in pre-hospital care, we wouldn't be where we are today. Thank you.
That should have been perfect.